Assalamu alaikum. My name is Amara Sheikh and my roll number is BP1650027. The topic of my today's presentation is drug amoxicillin plus clavulanic acid. Now let's discuss about amoxicillin plus clavulanic acid. It is a combination of a drug that is used to treat bacterial infections of air, lungs, sinus, and skin or urinary tract infections. Amoxicillin comes in the class of penicillins like antibiotics. It inhibits the growth of bacteria. While clavulanic acid comes in the class of beta-lactamase inhibitor, it inhibits the bacteria from destroying amoxicillin. Now let's discuss about rational and irrational use. Amoxicillin plus clavulanic acid is used to treat urinary tract infections caused by susceptible bacteria such as urinary tract infections, respiratory tract infections, skin infections, soft tissue infections, sinus infections, tonsillitis, catch scratches, etc. It is also used to treat tuberculosis. Do not use amoxicillin for the longer period of time as it leads to the secondary infections, that is the infections of oral bladder or vagina infections. It is used with the extreme precautions during pregnancy and lactation. There are some side effects which includes here are some adverse effects, which includes diarrhea, vomiting, nausea, skin rash, etc., etc. Contraindications. There are some contraindications also related to the amoxicillin plus clavulanic acid. It is contraindicated in the conditions like granular fever, penicillin hypersensitivity, or lymphomas. The toxic effects of amoxicillin plus clavulanic acids have been reported. The most common toxic effect is an iodocyanatic drug induced hepatic injury, which leads to the mixed hepatocellular cholestasis injury, and it is common in the older mans. Here are some drug interactions of amoxicillin plus clavulanic acid. The drug name is acinocumarol. The risk or severity of the bleeding can be increased when clavulanic acid is combined with acinocumarol. Now, BCG vaccines, the therapeutic efficacy of BCG vaccine can be decreased when used in the combination with clavulanic acid. Acimatoxin may be decreased the excretion rate of amoxicillin, which could result in the higher serum levels. Now, there are many dosage forms of amoxicillin plus clavulanic acids for adult and pediatrics, which includes oral suspensions and tablets also. Here are some brand names of amoxicillin plus clavulanic acids, which are Calamox, which is made by Bosch Pharmaceuticals, Amoxiclav, which is made by Novartis Pharma, Augmentin, which is made by GSK. The most pocket friendly is Calamox, which is of rupees 120. Here is the case study regarding amoxicillin plus clavulanic acid. A 20-year-old woman with no previous history of urinary tract infections complains of burning on urination, frequent urination of a small amount, a bladder pain. She had no fever or no severe tenderness. A clean catch midstream urine sample shows gram-negative rods on the gram stain. A culture and sensitivity test is ordered. Based on these findings, a patient is presumed to have a lower urinary tract infections. What treatment options are available for the patient? The height of the patient is 64 inches, while her weight is 55 kg and the age is 20 years. And the patient is female. Her BMI is 10.0. The urine sample shows gram-negative rods on gram stain. She have no fever and no severe tenderness. Frequent urination of small amount is observed. The assessment is she is assessed with the lower urinary tract infection, and the plan is a 3-day antibiotic treatment regimen is effective to cure her urinary tract infection. Medication to eradicate urinary tract organisms. Follow up with the primary care provider too. The therapeutics are based on the patient's lab result, which is with the lower urinary tract infection. She needs to be on 3 days antibiotic regimen. to eradicate urinary tract organisms. This patient would be benefit from Augmentin, one 500 mg tablet every 12 hours, Bactrim DS for every 12 hours, and ciprofloxacin 500 mg thrice a day. Here are some precautions or note for urinary tract and lower urinary tract infection. The patient should drink the plenty of liquids, especially water. She should have to drink cranberry juice. Do not hold the urine for longer period of time. Talk to your doctor about managing any urinary difficulties and fully emptying your bladder. Thank you.